Welcome to the State of Health. I'm Dr. Rahul Gupta, State Health Officer and Commissioner of the West Virginia Bureau for Public Health. Your host, Department of Health and Human Resources Cabinet Secretary Karen Bowling, will be back for our next show. Cancer is the second leading cause of death in West Virginia, behind heart disease. But if these trends continue, cancer will become the state's leading cause of death in the next decade. That's why the West Virginia Cancer Plan, released in April, is so important to reducing those numbers. Sarah Liu has more on this report.
I remain active in Mountains Hope because of my own cancer.
Bruce Atkins is a 14-year cancer survivor, along with most in this room, when asked if they were affected by cancer, either personally or through someone they knew.
I learned that I had cancer of the base of the tongue literally after umpiring a baseball game, and I had some bleeding.
After 25 years as a surgical physician assistant, he's now a public health official with the state. He and the Comprehensive Cancer Program Lead for the Bureau for Public Health helped the Cancer Coalition, Mountains of Hope, roll out West Virginia's 5-year cancer plan.
The state plan itself actually, for the first time, encompasses all of public health. So it looks at all chronic disease as a whole, including cancer, obviously.
In 2016, it's estimated 11,700 West Virginians will be diagnosed with cancer. About 4,700 are expected to lose their lives to the disease. This plan includes 5 overarching goals, but specifically calls for increasing screening rates, improving access to healthy foods, increasing physical activity, and reducing smoking rates in West Virginia.
First and foremost, the people of West Virginia will take this cancer plan back to their communities, and whether it's through their own coalitions or organizations, start developing their actions within their communities to obviously prevent and control cancer.
And cancer survivors like Bruce will be there to help.
Having the perspective of cancer survivors in the continuum of care and people involved that have been there, done that, is very important. I feel like I can make a difference.
For the State of Health, I'm Sarah Liu.
So that is what the state, in partnership with the Mountains of Hope Cancer Coalition, is working towards. Efforts also are underway on the medical front in West Virginia to fight cancer. Our first guest is Dr. Sally Hodder, who is the director of the West Virginia Clinical and Translational Science Institute at WVU Health Sciences in Morgantown. Dr. Hodder has recently been appointed to the National Institutes of Health's Advisory, Allergy and Infectious Disease Council by the U.S. Secretary of Health and Human Services, Sylvia Matthews-Burwell. I want to welcome you, Dr. Hodder.
Thank you.
Thanks for being on the show, and let's get started.
Okay.
Well, tell us more about what is CTSI.
So CTSI stands for the Clinical and Translational Science Institute, and it is the West Virginia Clinical and Translational Science Institute. The basis goes back actually about 20 years when Congress looked at what states were procuring research funds to positively impact health in their states, and it was found that just 8 states got more than 50% of the money. Wow. And they started a program called the IDEA program to earmark funds for states that were not getting their fair share. And I think that's extremely important because Sure. If the research is done in New York City, it is likely not to focus on regional problems such as we have in West Virginia.
Sure.
And so the West Virginia, the CTSI was funded in 2012 to build research infrastructure, but not esoteric research. The purpose is to really find, real solutions for real problems.
Sure.
And there's really a whole spectrum of programs that we have that are doing just that.
And it's really, would you say it's more of a figuring out how to translate that research also into communities' action?
Yes, I think it's a couple things. I think first and foremost, we have roughly 60 practice-based research network sites. These are clinics out in rural areas, and we want to hear from the folks in those communities and the providers
Sure.
What are their problems? What are they interested in?
Absolutely.
We want to do research and bring cutting-edge clinical trials to West Virginia, to the people in rural areas. They are always underrepresented in clinical trials and absolutely deserve and must have access to cutting-edge science to positively impact their health. And then what we find out, we want to communicate back to the community,
Sure.
because clearly they had a stake and participated in it. So those are sort of the three phases.
Oh, great. And then we know the focus of the CTSI is, of course, cancer. It's also heart disease, stroke, and obesity, as well as some of the substance abuse challenges that our state is facing with currently. So I want to start by asking you, what about the link between cancer and perhaps some infections? Are there some infections perhaps that can lead to cancer? And tell us about that a little bit.
Yes, there are, and this is really been over the past couple of decades that we have seen several examples of infections that are associated with cancer. Probably the most important for West Virginia is liver cancer. Hepatocellular carcinoma is the fancy name, but it's liver cancer, and it is commonly seen in individuals who have chronic hepatitis C. Now, the problem for West Virginia is that our rates of acute hepatitis C have tripled from 2010 to 2014.
Exactly.
And if you look at 100 individuals who get hepatitis C, 85 of those will actually develop chronic infection. The infection, unless they seek treatment, will not go away. And in up to 20% of folks, they can have severe liver damage, and it's in that group where we see the greatly increased incidence of hepatocellular cancer or liver cancer.
So our challenge is, of course, that this hepatitis C, there's a number of, these organisms of viruses, A, B, C, and onwards, but it's the C that seems to be we're having a higher rise, but at the same time, it's infection, as you mentioned, it leads to chronic infection that can lead to perhaps cancer risk. Talk to us, how do people get hepatitis C, or what is their risk of getting hepatitis C?
So hepatitis C, first and foremost, is passed by exposure to infected blood. Less commonly, hepatitis C, it can also be transmitted through sexual activity or from a pregnant mother to her baby in utero. For us in West Virginia and for much of the United States, with the surge in intravenous drug use, sharing needles or even sharing the cottons or cookers associated with intravenous drug use can result in infection.
Absolutely. And that's, I think, what we saw in Scott County, Indiana.
Yes.
That in rural populations, the risk of spreading these diseases goes up.
No, absolutely. And I think, one of the concerns is only half the people who have hepatitis C, it's estimated, know they have it. The other half have not been tested. So it's very, very important, I think, for folks, if they are using intravenous drugs or have ever used it might have been 20 years ago, you're still at risk. Individuals who have HIV infection or individuals, who are on hemodialysis should really be sure that they're tested for hepatitis C because there's treatment.
Exactly, and even now their screening guidelines recommend that if you were born between 1945 and 64, you should try to get screened. So I think it's one of the things is making aware people that get tested if you are the appropriate candidate for hepatitis C screening. There, of course, are other hepatitis viruses and other reasons for liver cancer. We could talk about those a little bit, other viruses perhaps, the hepatitis viruses and how bad they are across the state.
Sure. Well, the other virus that is associated with liver cancer is hepatitis B. Hepatitis B is also passed by transmission through contaminated blood and to a higher extent also through sexual activity, particularly among men who have sex with men. And a mother who has chronic hepatitis B has a very high chance of passing that to her baby, unlike with hepatitis C.
Sure.
Now, the issue is with hepatitis B is that we have no drugs today that can cure it.
Correct.
Though we can treat and bring the amount of virus in the blood down, which actually is helpful and decreases the incidence of liver cancer. But I think it's extremely important for hepatitis B. We have a vaccine, a very effective vaccine. And it is recommended for all children in their early years, and in fact has brought down among children and adolescents hepatitis B rates to about 95% have come down. The problem in West Virginia, we actually are one of the highest rates of new hepatitis B, and I think that reflects older folks who've not gotten the vaccine, and again, some of the issues around intravenous drug use.
Right. And then that's the unfortunate part is we are highest in prevalence of Hep B, hepatitis B, and then the second highest, I believe, in hepatitis C, although as you alluded to, hepatitis B is largely preventable through vaccinations, and for hepatitis C, the awareness and that there is an ability to treat now hepatitis C. Speaking of immunizations, what fascinates, I think, a lot of individuals in public health is that there are viruses that can cause cancer, just like hepatitis B, but then you can actually avoid that cancer by immunizing people at early age. So any other, in fact, we're talking about the human papillomavirus. If you want to talk about that a little bit, how is that important in making sure that that public health aspect is also addressed?
Oh yeah, no, that's extremely important. Human papillomavirus is the virus that is associated with cervical cancer and also with oropharyngeal, throat, tongue cancers, and anal cancer.
Sure.
And it is a very prevalent virus. In fact, estimates are that by the time you're in your 50s, 80 to 90% of folks have become infected. Most people, the infection after a year or two, your immune system will actually destroy the cells that are infected. But in some folks, the infection becomes chronic, and it's a very sneaky virus. It goes in and it commandeers the cell in your body to actually make proteins that then cause the cell to grow abnormally and not be subject to the usual controls.
And you may not be aware of that.
No, it's absolutely asymptomatic.
Yeah.
And as you know, for years, cervical cancer rates have come down with active Pap screening.
Absolutely.
They look at the cells. If the abnormal cells are there, you can actually remove them before they turn into cancer. But I think the wonderful news over the past decade or so is that we now have a vaccine that we can give to our kids before they become sexually active. They will not get human papillomavirus, and they will not get cervical cancer in men, penile cancer, and again, the oropharyngeal cancer. So I think that this is critically important that we vaccinate our kids.
Both boys and girls.
Boys and it's interesting. Initially, the studies were only done in girls. I happen to have boys, and subsequently they did do the studies in boys. But it is absolutely as important in boys.
Absolutely. So that's great to know that whether it's your children, your grandchildren, that's one way to protect them against cancer, especially future cancer, by ensuring that they are immunized and vaccinated. And what a time where we can actually prevent cancer through a vaccine. Anything exciting real quick before we end about CTSI that you're really excited about in the future?
Oh, I'm excited about a lot of things. I don't think we have time, but I would say back to the hepatitis C issue, that if you're treated, we don't have a vaccine for hepatitis C, but if it's treated early before you get the liver damage and the scarring, you have a much lower chance of getting cancer. And the CTSI is working with the Cabin Creek Health System and others in the state, the Primary Care Association of West Virginia, and we're actually developing what's called an ECHO program to have hepatitis C expertise through teleconferencing be available to communities and hopefully increase treatment and ultimately decrease liver cancer in this state.
Perfect. Folks can look up Project ECHO. I think that's another exciting thing that's happening. I want to thank you for being here today and bringing us all this wonderful news about the West Virginia CTSI program. Thank you.
Thank you.
Great. And coming up, we'll take a look at what's being done to treat various forms of cancer, including a new generation of cancer treatments called targeted therapies. And it's happening right here in West Virginia. Stay with us.